I'm Daniel DeSalvo, a pediatric endocrinologist, and I've been living with type 1 diabetes for over 20 years. In my clinical practice and personal life, I've found that the impact of time and range for diabetes management has been immenseful. If you're a healthcare provider caring for people with type 1 or type 2 diabetes, you need to know about time and range. Time and range is the amount of time a person's glucose levels are spent within their target range. Now, the target range may vary for each person, but for many, a healthy range is considered between 70 to 180 milligrams per deciliter. It's recommended that a person with diabetes spends at least 70% of their time, about 17 hours per day, in this target range, which equates to an A1C of less than 7%. Now, A1C has long been the standard for assessing glucose management, but it has many notable limitations. A1C is a passive measure of the average glucose over the last 3 months. It doesn't capture the lived experience of a person with diabetes 24/7, 365. It only shows one small snapshot in time, and it doesn't help with making clinical decisions. For example, an A1C of 7%, you could have 100% time in range, or you could have just 50% time in range with a lot of hypoglycemia. Furthermore, A1C is not reliable for patients with conditions such as iron deficiency, sickle cell disease, or other hemoglobinopathies, patients with severe kidney or liver disease, or those who use certain medications. It's time for a paradigm shift for clinicians to utilize time and range for diabetes management. Analyzing the amount of time a person spends each day is a powerful and data-driven tool for assessing glucose control and optimizing therapy. Going beyond A1C to assess time and range can help you figure out what's causing glucose excursions so that you can come up with a plan for your patient to safely and effectively improve their glucose control. It's noteworthy that just a 5% increase in time and range is clinically meaningful. It's about making small, impactful changes over time. 5% is just an hour per day. Even that can make a big difference in a person's life. Now, CGM is the ideal tool for measuring time and range. It's a small wearable sensor and transmitter that can measure and send real-time glucose values to a smart device, receiver, or in some cases, an insulin pump. The ambulatory glucose profile, or AGP, is a standardized report for evaluating CGM metrics through retrospective data review. Similar to an EKG, the AGP shares easy-to-interpret graphs and actionable information on the glucose trends. There are 3 main components of an AGP: the summary of glucose metrics, the aggregate trend graph by time of day, and the daily graph of glucose trends. Now, we've heard a lot about the numbers and metrics, but how does time and range actually make a difference in someone's life? To answer that, I'm thrilled to bring in one of my close childhood friends and lifelong best friends, someone who you may know also, country music star Eric Paslay. Eric, welcome.
What's going on, buddy? How you doing, doctor?
Doing very well.
I love I get to call you Dr. DeSalvo. It's amazing, man. So Daniel and I met. We used to be in a band together, and we used to do major shows. We actually tricked Daniel's mother into believing we were on MTV, and I believe we have a clip of that right now for you all to see. Daniel and I in a band together shredding "Don't Worry, Be Happy," and we nailed it, man.
So don't worry.
In my life, you're a huge impact on me, buddy, because you were the first person to really encourage me to play music. I think I was in my room playing along with a CD, or I don't know, my dad had an old guitar or something, right? And you came in and were just mind blown that I could play by ear. I could just kind of noodle to the melody on the guitar, and your encouragement definitely helped me keep playing guitar. You know, I mean, the encouragement of people you look up to is amazing, and I love that you're using that, just your good vibes and all that to encourage your patients to have time and range. And I love that we're getting to talk about it today.
Well, Eric, you know, I'm proud of you also, man. The way that you've used your platform, both as a musician and a person with diabetes, to really help inspire others has been awesome. Now, when it comes to time and range, we know that achieving more time and range with less hypoglycemia is the way to go. And one way to think about that is to go for more green and less red on the time and range bar. For me, I found that getting more sleep and more exercise really helps with increasing my time and range. I'm wondering with you, any personal experiences, maybe from your music or from your performances, where you found that using CGM helps to increase your time and range and prevent hypoglycemia?
Oh, I'm with you. Exercise definitely helps me have more time and range. When we're out working on the farm, I've always got my snacks with me. Every person with diabetes, it's like, have your snacks in case you have that urgent low. And the coolest thing about the CGM, what I love, is the urgent low soon notification that catches it before we even get there. And you always hear that beep, 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 and go, whoops. And we were joking earlier. I've got a little girl. She's 2.5 now, Piper. And I love that I have a daughter now because she has this amazing baby food, which has helped. I like the little packets. They like save the day so many times for me. A little trick of saving the low glucose levels. But yeah, definitely exercising on the farm. And so it is hard for me. If I'm not playing shows, I'm writing songs. So it's sitting, which a lot of us do. We sit, we're in front of a computer, whatever job you have, a lot of us just sit still. So I feel like that insulin isn't always moving through me as well as it could be when I'm active on the farm. I also, over the time of wearing a CGM, I don't know how many patients you have, but when I drink caffeine, when I drink coffee in the morning, it's like, what in the world is happening? There's no carbohydrates in this. Could you talk more about, I mean, there's so many strange things, amazing just chemical reactions of you put this in, this happens to your glucose level. Can you tell me what's happening when that happens? How do I spend time in range when drinking coffee?
So Eric, you're absolutely right. We know from CGM that there are a myriad of factors that can affect glucose levels. It's not just as simple as the insulin you take or the food that you eat. It's much more than that. For you, you found that caffeine causes that glucose spike. I've seen the same thing for me when I have my cup of coffee in the morning, as well as with many of my older patients who drink coffee. I found that just a little bit of insulin can help to counteract that glucose spike. For you, I'm wondering if you've noticed if other choices or different things that you might be doing influence your glucose levels in your time in range.
Oh, most definitely. After wearing a CGM, I realized how much the pastas, the breads, cereal, all those grains affect. I mean, it just gets me and sends me soaring. So I definitely take insulin before eating. I think one thing with me personally, when we had that instant, Novolog, Humalog, it works instantly. It's like, it does, but you need to pregame before you're get that insulin in you before you start eating those really thick carbs. I think we all have those type of foods that affect us the most. But I mean, those pastas, those pizzas, and especially cereal. I mean, I used to eat a bowl of cereal every night when we were younger. I like teenage Eric. I don't even know where I was at night. Who knows where my glucose level was soaring. So I'm grateful we have this, now it's kind of terrifying to me. Like, what? My A1C was good, but where was I really at? So it's amazing and terrifying when you actually see behind the curtain of what's going on really in our bodies now that we have such an amazing device. I call it like a GPS of your glucose level. It's like, it always kind of shows where you're going, which I love seeing that.
Yeah, I mean, I think you said it well. The CGM is sort of like a GPS for your glucose. And there's so many insights that we can glean. And CGM can be really impactful as a learning tool where you learn from cause and effect and sort of course correct the next time around. And in my clinical practice, I really use those CGM insights, the Dexcom Clarity Ambulatory Glucose Profile, or AGP, to sit down with patients and families, have a discussion to identify patterns and trends, and really use shared medical decision-making where we work creatively together to make therapy adjustments to optimize their time in range. A recent survey from Dexcom found that 53% of people with insulin-treated diabetes have never discussed time in range with their healthcare provider. And a majority shared that they believe it's the responsibility of their diabetes care team to bring new standards of care to their attention. So it's up to us as clinicians to talk about time in range with our patients. There are a lot of tangible benefits to time in range. A majority of people with diabetes say they feel better and healthier when they spend more time in range. And I love that it's goal and action oriented. It's a chance to celebrate small wins. Remember, just a 5% increase in time in range is clinically meaningful. Eric, I'm wondering for you, using CGM and discussing time in range, has that helped to impact the way that you interact with your diabetes care team?
So one of the best parts on the road when I'm on tour is when I'm rocking on stage, I have a whole team of guys that have the follow-up. So my manager, my in-ear monitor guy, who's running all the fancy inners that we wear that you see on stage, if the rule is, if I'm dropping below 110, he tells me in my in-ears, Eric, go look at your CGM, make sure that if you need orange juice or not. And so it's an amazing thing. The Follow app is amazing. And the best part is my wife can watch it from Nashville, even when I'm rocking in Wisconsin or wherever I'm at, even in London, wherever we're playing a show. So it's a pretty amazing thing, but it definitely catches those low glucose levels before it ends the show. You know, the show always goes on because of Dexcom, because of the CGM, and because of the Follow app. So you've seen it at the shows. I've got the Dixie cup full of orange juice just in case we've got one of those lows approaching. But it's just amazing, this technology, and it helps me as a professional performer every night. Every show goes on because of Dexcom.
Yeah, that's a really impactful way to use that Dexcom Follow app to keep your time in range for a show. You know, I found that in my clinical practice, having those alerts for low and high and urgent low soon really helped me stay on time, have good appointments with my patients, and really helped me do my job well also.
Please get a CGM, and it'll change your world. And I know it's a lot of people I meet on the road, all ages. They're like, I just don't want another thing on me. And I'm like, wear it. If you can get past 2 weeks, you won't even realize it's there. You know, you'll notice it for maybe a week or two, or maybe you just put it on, you won't ever notice it. But I think when it comes to anything in our lives, change is scary. And people don't need to be scared of this change. Like, I mean, it is for the better. I don't know how I'll never not be able to wear a CGM. And you can't really, you won't know your time in range if you're not able to wear a CGM. So it's pretty amazing, this technology, and that we get to even talk about it because we're spoiled enough to get to wear them. So it's pretty amazing. I love what you're doing right now with your life. And I've always looked up to you, and I love that we're getting to hang out and help encourage people to spend more time in range together.
Well, you were my first friend with type 1 diabetes, and you were always an inspiration to me. When I was diagnosed, when I was 19 years old as a sophomore at Baylor, you were the first person I called. And your parents were the first ones that my parents called. And so you've been part of this journey for me from the very beginning. And it's been really great to see how professionally both of us have kind of found our passion areas, our niche. I'm able to help people live with diabetes, and you're able to inspire them. So keep up that great work and all that you do. And I'm so glad that we've had this chance to meet together.
Man, good to hang with you. Let's go catch some fish one of these days in Texas.
Let's do it. There are many helpful resources available to clinicians and people with diabetes to educate themselves on the impact and power of time and range for diabetes management. You can find out more from the global movement for time and range at wheninrange.com.